does not take place in a day or two. When we talk about 2047, we can understand how we have to develop the roadmap to see to it that we realize at 2047 what is Viksit Bharat and what is the health structure at that point of time and health systems at that point of time. So keeping this factor in view, I congratulate and I really commend CII for choosing this theme and working in this direction. In this August gathering, we have policy makers, we have got members from who are the stakeholders, and also the members from the industry. We are here to drive the India's healthcare growth agenda. And when I say about the growth agenda, I also congratulate CII for having deliberations where we have interactions related to health sector. And these interactions are certainly going to develop a system, a platform where we can think about the growth of the nation building in the health sector. And I would also like to emphasize that the CII has tried to prioritize the healthcare, which can harness the demographic dividend. And when I say so, we have to really utilize the demographic dividend which we are getting at this point of time. We have to concentrate on innovation, and we have to also position ourselves as a global leader. And by doing so, we have to strategize, look into the minute nitty-gritties and details, how we can get these this position and what we have to do for that. If I talk from the government perspective, I would like to say that under the dynamic leadership of Prime Minister Modi, a lot has been done in the health sector. And when I say so, it's not just a slogan or just not a statement which I'm giving. It has been done in reality. You see, we had a health policy in 1997. And beyond 1997, there was no thinking about the health policy, how we have to go forward. And the only concentration at that point of time was curative, only taking care of the curative part. It was in 2017 that we deliberated for a new health policy. And in 2017, we started the work in 2015, where we started the consultation process. And wide consultation took place throughout the length and the breadth of the country on various subjects related to health. And then we came out with a holistic, comprehensive healthcare system, which is known as Health Policy of 2017. And when I say so, it was not only curative. We first time emphasized on the preventive part of the healthcare system, the promotive healthcare system, the curative part, the rehabilitative part, and we also took initiative to see to it that we have to also take care of the geriatric part. So now when we talk about the health policy, it is a policy which is preventive, promotive, curative, rehabilitative, palliative, geriatric. It's an inclusive. And when I say so, I would also like to remind that we have to also take care that healthcare should be affordable, accessible to each one of us. So, ये health policy में change कहाँ आया? हम piecemeal में सोचते थे. We used to think in silos, in piecemeal. किसी ने preventive part पर सोच लिया, किसी ने holistic approach नहीं था, inclusive approach नहीं था. It was in 2017 that we came out with a policy where we tried to make it affordable, accessible, inclusive, and at the same time taking care of the preventive part. I would also like to share with you that in the past 10 years, we have taken a leap forward. और जब हम leap forward बोलते हैं तो हमने एक लंबी छलांग लगाई है और कहने के लिए नहीं. For preventive part, we have got now 1,77,000 Ayushman Arogya Mandirs. This is the first contact point of the citizen with the healthcare facility. This is the first contact point. And now we have got a very ambitious plan, which Sanjeev Kapoorji was talking about. And he was talking about the prevention part, that is going to reduce the health burden. And what we are doing now, that in 1,75,000 healthcare systems, we have got a community health officer. And we have got a telemedicine system attached to the specialists, so that a villager may not have to go to a health institution if not required. And he can get the consultation at his Ayushman Arogya Mandir, and that is how we are trying to see to it. And what we are doing, we are screening at the age of 30 for ladies for cervix cancer, ladies for breast cancer, male and female for oral cancer, for hypertension, for diabetes, for dental care, for mental care. These are the areas where we are screening. Now, when at the age of 30, a person comes to know that he is diabetic, or he is prone to diabetes, or he is coming closer to the diabetes, blood sugar is on an increase. We will be able to see that in coming times, we can save a patient from going for a renal failure. We can save, if we have come to know about a patient that he is subjected to hypertension, we can see to it that we can at least caution him so that he does not have heart diseases in coming times. So this preventive part has been taken care, and these Ayushman Arogya Mandir are having NQAS, National Quality Assessment Standards. And they have to do it themselves, and we also try to see to it that the NQAS level is there. It's not an institution which does not have the standards. So we are also trying to see to it that the standard is maintained at the grassroots level. We get quality health care. That is what we are trying to go. If I talk about the tertiary health care, we have taken a long leap. You see, I would not like to, from this forum, I would not like to talk politics, but I would like to certainly put things on record. We had only one All India Institute of Medical Sciences. It was Atal Bihari Vajpayee, when he became the Prime Minister, we had 6 All India Institute of Medical Sciences. And today, under the dynamic leadership of Prime Minister Modi, we have got 16 additional, 23 All India Institute of Medical Sciences for tertiary healthcare. And we have tried to give them the world-class facilities, state of the art. When I was young, I used to say, why do you go to America? Why do you go to England? They say, we don't have the facility here. We want to do research. What can we do? We don't have the facilities here. But now I can say that India has got the state-of-art facilities here in India, where we can do research also, and we can do all type of clinical trials and do much in the medical education. In the past 10 years, we had only 387 medical colleges. Now we have got 780 medical colleges. We had the MBBS seats, only 51,000. Now we have got 1,18,000 medical seats undergraduate. And within next 5 years, we have decided that we will have 75,000 additional medical seats for the medical education. That is what we are trying to do. For post-graduation, we had only 31,000 seats. Now we have got 74,000 seats for post-graduation. So big leap has taken place, which I would like to know. I'd also like to share with you, what Sanjeev Kapoorji was talking about, Ayushman Bharat. You know, in 2015, India got the presidency of World Health Association. And I was there as the health minister there at that point of time. And I got the opportunity to preside over the World Health Assembly. In those days, the catchy word for the health sector was UHC, Universal Health Coverage, Universal Health Coverage. And I thought at that point of time that whether India will be able to achieve this goal. It was an idea which मुझे ऐसा लगता था ये सपनों की बात है, ये होना संभव नहीं है. But when I came back, I discussed with Honorable Prime Minister, and Prime Minister said नड्डा कुछ बड़ा सोचो, छोटा नहीं सोचना. And now I can say that Ayushman Bharat is the world's largest health coverage program which we are giving. It is the world's largest health coverage program. 62 crore people. Now above 70, every citizen of any economic status, till death, till the last breath, he is being given a health coverage of 5 lakh rupees per year, per family, per individual. That is how we are going to do. Now, when I talk about Ayushman Bharat, 62 crore people. And when we talk about Digital India, I would like to share with you that the whole Ayushman, it is not an insurance program, it is an assurance program. We assure you that you will get 5 lakh rupees health coverage every year per family. That is what we have assured for 62 crore people. Approximately some 14 crore families are included in it, which means 40% of the Indian population. 40% भारत की आबादी को हम cater कर रहे हैं. And what it is cashless. You go to the institution, put your thumb, get recognized, they will tell you that yes, 5 lakh rupees is there for you. Now you go for your examination, and whatever treatment is done, when you come out of the treatment, when you are discharged, there's a message. Are you satisfied with the treatment? Yes. The moment you say yes, the money is transferred. A person, a laborer from Jharkhand, who is serving in Mumbai and having his treatment done in Tata Memorial Hospital, the money straight goes from Delhi to Tata Memorial Hospital digitally, and the cash payment is done digitally. So it is transportable. It is transportable. And the number is 62 crores. तो अब डिजिटल इंडिया में बच क्या गया? ये डिजिटल इंडिया का सबसे बड़ा एक एग्जाम्पल है जो which we have to understand. So this is how, and I would like to share with you that 9 crores 40 lakh hospitalizations has been done since 2017 when this Ayushman Arogya Mandir came into existence. And 1.32847 crores of amount of money has been spent on the poor people for their treatment. This is how we are going forward. This has reduced the out-of-pocket expenditure also. The out-of-pocket expenditure in 2014 was 62.6%, and now the out-of-pocket expenditure is 39.4% of the total health expenditure. So we can understand how Ayushman Bharat has really served the people of the country. Lancet recently gave, Lancet, the renowned journal related to healthcare, needs no introduction. Lancet has said that because of Ayushman Arogya Mandir, 90% of the patients who are detected with cancer, they get their treatment within 1 month. The treatment starts. That is what Lancet has reported. So that means that the poor people are now getting treatment for tertiary healthcare, cancer patients, for other diseases. That is what I'd like to share with you. One more very important initiative we have taken is ABDM, Ayushman Bharat Digital Mission. And in this Ayushman Bharat Digital Mission, we have tried to give every individual an Aadhaar card, Ayushman Bharat Health Accounts, where you have got all your health record, which is your private property. It is yours. You can, if you want, then only your health records can be shared, and according to your consent. Otherwise, it cannot be shared. And you will be happy to note that the same ABDM has got the registry of the facilities, health facilities, and the registry of the health professionals also. And we have been able to have 55 crore people have got now the health records. 68 crore people have got Aadhaar cards, and 55 crore people have got their health records in that health system which we have done. And 4.1 lakh health facilities have been registered, and 6.31 lakh professionals have been registered in this. So this is how we are trying to see to it. And it has got 3 gateways. One is that unified health interface. The another is the health information consent manager, where without consent your health records cannot be shared to anyone else. And the health claims exchange. All health claims exchange will come under one platform. That is what we have tried to develop here. So this is how we have tried to see in the health sector, digitally we can make an individual empowered so that he can get the best facilities from the best professionals. That is what we are trying to do. As far as the pharmaceuticals and medical devices is concerned, India has come up as a leader. And when Suchitra ji is here, I would like to certainly commend her and her efforts. When we talk, मैं जब हेल्थ मिनिस्टर पहली बार 1998 में स्टेट में बना तो हम क्या सुनते थे, व्हाट वी यूज्ड टू हियर, कि टेटनस की दवा को भारत में आने में 40 साल लग गए. ये बीसीजी वैक्सीन को आने में 20 साल लग गए. जापानीज इंसेफ्लाइटिस की दवा को आने में 100 साल लग गए. 1906 में जापान में आ गया था. 2006 में हमारा नेशनल प्रोग्राम में जापानीज इंसेफ्लाइटिस जुड़ा. 100 years it took. But when corona came, it was in 2020, second week of January when the first case was detected. And it was in third week of April when Prime Minister set up a task force. And India, within a short span of 9 months, came out with not one but 2 indigenous vaccines. That is India, and this is the changing India which we have to understand. And Suchitra ji, Biotech, did a commendable job with ICMR at that point of time. And अब अगर मैं वैक्सीनेशन की भी बात करूं, हाउ थिंग्स हैव चेंज. सबसे पहले तो अगर कोरोना के मैनेजमेंट की बात करूं, लॉकडाउन लगे या न लगे, यूरोपियन कंट्रीज में इस पर स्ट्राइक हो गई. लेकिन ऑन द कॉल ऑफ प्राइम मिनिस्टर मोदी, वी हैड जनता कर्फ्यू, एंड आफ्टर दैट वी हैड द लॉकडाउन व्हिच वाज डन फॉर 2 times simultaneously, and people adhered to it. And we went for a vaccination program. Now, if you talk about vaccination program, India कैसे मजबूत हुआ है, that we have to understand. अमेरिका जैसे कंट्रीज में, बाकी सारी कंट्रीज में कहीं 50%, कहीं 60% वैक्सीनेशन हुआ. हमारे देश में it was the world's fastest vaccination program. In a short span of 6 months, we had 222 crore double dose vaccination was done in India. That is what here. With booster. ये हमारा फास्टेस्ट वैक्सीनेशन प्रोग्राम हमारा चला. और ये इंडिया चेंज्ड इंडिया, बदला हुआ भारत जो है वो हमको समझ में आता है कि किस तरीके से. अमेरिका में अभी भी कोरोना का सर्टिफिकेट कागज पर मिलता है, और भारत में सर्टिफिकेट आपके मोबाइल पर मिलता है कि यू आर वैक्सीनेटेड फॉर कोरोना. ये आज परिवर्तन आया है. And we supplied to 100 nations these vaccines. 48 nations we gave them free of cost under vaccine Maitri. So this is the change which has taken place. और इसमें प्राइवेट सेक्टर ने बहुत बड़ा रोल अदा किया है, और प्राइवेट सेक्टर ने बहुत तरीके से इसको आगे बढ़ाने में हमारी मदद की है. ये मैं ज़रूर आपके साथ शेयर करना चाहूँगा. We are called as the pharmacy of the world, and the 60% of the vaccines by volume, वो हम जो वर्ल्ड का वॉल्यूम है उसको 60% हम उनको दे रहे हैं. मेडिकल डिवाइस में भी हम बहुत आगे बढ़े हैं, और मेडिकल डिवाइसेस में भी हमने एक लीड ली है. हमें what we expect from industry is in the innovation for screening part. जो हमारी स्क्रीनिंग है, बिकॉज वी हैव 1.4 बिलियन पीपल. कोई भी हम नेशनल प्रोग्राम लेंगे तो फर्स्ट ऑफ ऑल वी हैव टू गो फॉर स्क्रीनिंग. अभी आर्टिफिशियल इंटेलिजेंस से जो हैंड हेल्ड एक्सरे मशीन्स आई हैं, जो एसिम्प्टोमेटिक पेशेंट्स को भी ट्यूबरकुलोसिस में पकड़ लेती हैं, सिर्फ उसके चेस्ट पर वो हैंड होल्ड एक्सरे मशीन रखने से वी कम टू नो दैट ही मे बिकम अ ट्यूबरकुलोसिस पेशेंट। ये जो एआई के माध्यम से ऐसे इस तरीके के जो हमारे डिवाइसेस हैं, उसको फॉर टियर 2 एंड टियर 3 सिटीज़ के लिए ये बहुत मीनिंगफुल है, और इसके साथ साथ हमारे रूरल एरिया को सर्व करने के लिए बहुत आवश्यक होगा। तो मैं चाहूँगा कि प्राइवेट सेक्टर इस मामले में हमारी मदद करे, हमको आगे अनदर एरिया इज टेलीमेडिसिन, क्योंकि नाउ द एस्पिरेशनल इंडिया, जो एस्पिरेशनल इंडिया है, नाउ ही वांट्स, एनी इंडिविजुअल वांट्स अ ट्रीटमेंट बाय अ सुपर स्पेशलिस्ट, बाय अ स्पेशलिस्ट। तो टेलीमेडिसिन, हमारी कोशिश है कि हम आयुष्मान आरोग्य मंदिर के साथ उसको जोड़ रहे हैं, टेली कंसल्टेशंस कर रहे हैं, बट in this area private sector can come in a big way and that can also give us a big boost जो हमारे को मदद मिल सकती है, वो मैं ज़रूर आपके साथ शेयर करना चाहूँगा। इनोवेशंस में मैंने आपसे पहले कहा कि प्राइवेट सेक्टर हैज़ गॉट अ वेरी इंपॉर्टेंट रोल टू प्ले, और उनके माध्यम से वी विल बी रियली, इट विल बी ग्रेट हेल्प टू अस। मास स्क्रीनिंग्स is a very important area where we are trying to go forward. उसमें भी प्राइवेट सेक्टर कैसे हमारे साथ मिल सकता है, जुड़ सकता है, क्योंकि हेल्दी इंडिया बनाने के लिए हमारे को स्क्रीनिंग पार्ट पर बहुत जोर देना है, और सिर्फ गवर्नमेंट के एपरेटस से सिर्फ हो सके ये संभव तो हम करेंगे, लेकिन क्वालिटी ऐड करने के लिए प्राइवेट सेक्टर की मदद ज़रूर चाहिए होगी। तो मैं चाहता हूँ कि आपसे भी आह्वान करता हूँ कि आप इस तरीके से हमारे को उसमें मदद करें और हेल्थ सेक्टर को आगे बढ़ाने में अपना योगदान करें। मैं, जो हमारी रेगुलेटरी अथॉरिटीज़ हैं, उनमें हमने ह्यूमेन एंगल को जोड़ा है, मेड बी FSSAI, सेफ्टी स्टैंडर्ड्स हमारे की बात हो, मेड बी सिडेस्को, ड्रग्स की बात हो, मेड बी फार्माकोपिया कमीशन, हमने सब जगह कोशिश इस बात की है, क्वालिटी एंड स्टैंडर्ड्स नॉट टू बी कॉम्प्रोमाइज्ड, नॉट टू बी कॉम्प्रोमाइज्ड, बट डिले विल ऑल्सो बी नॉट एडहर्ड टू। डिले नहीं होना है, काम समय पर होना है। दैट इज हाउ वी कैन हेल्प, एंड वी कैन सी दैट द इंडस्ट्रीज गेट द ड्यू इन ड्यू कोर्स ऑफ टाइम, और वो जो अपनी उनकी मेहनत है उसके अनुसार वो रिजल्ट दे सके, रिजल्ट ओरिएंटेड हो सके, उसके बीच में रेड टेपिज्म शुड नॉट कम इन। तो इस बात को भी हमने इंश्योर किया है, और इसलिए हम कम्युनिकेशन में भी विश्वास करते हैं। वी बिलीव इन कम्युनिकेशन, एंड थ्रू कम्युनिकेशन वी विल बी सर्टनली एबल टू सी टू इट दैट हेल्थ सेक्टर, जो अंडर द लीडरशिप ऑफ प्राइम मिनिस्टर मोदी हैज़ टेकन अ लीप, उसको हम किस तरीके से आगे सस्टेनेबल और क्वालिटी हेल्थ, अफोर्डेबल हेल्थ दे सके टू द कॉमन मैन, उसके लिए हम काम कर रहे हैं। आप सबके सजेशंस हमें ऑलवेज दे आर वेलकम्ड, और आप कभी भी सजेशन हमको दे सकते हैं, उसको मैं लूँगा। आपने मेरी बात सुनी, आपका बहुत बहुत धन्यवाद।